Hi, I'm Charles Gauthier, President and CEO of the Downtown Vancouver Business Improvement Association. The DVBA is so proud to support this daily podcast series that is helping our community navigate through these trying times. As we all settle into what we hope is a temporary new normal, please consider helping support our local businesses. Whether it's by getting takeout from your favorite restaurant or giving a local shop a great review, it all adds up. Thanks, everyone, and stay safe.
I'm Tyler Orton. Before we get to today's interview, here are some of the top stories we're following today at Business in Vancouver. BC is extending its own state of emergency for another 2 weeks. The current measures against the COVID-19 pandemic are set to stay in place until April 28th. And the BC unemployment rate is set to hit 14% sometime this quarter. That's according to a new forecast from the Conference Board of Canada. But the think tank expects the economy to bounce back in the second half of 2020, with unemployment averaging 8% throughout the year. That's it for now. Now time for our interview.
Thanks for joining us today on Coping with COVID-19, our podcast from Business in Vancouver. I'm Kirk LaPointe, publisher and editor-in-chief. Our systems are changing, of course, as a result of the pandemic. We're undergoing an acceleration of the involvement of digital technology in our lives, and much of it's for the better. Certainly one field in which we can expect such change, we're even already experiencing it, is the health sector. And how might this sector evolve over the next number of years? I've asked Michael Bidu, who runs Interface Health, a digital health technology accelerator, to join me today to look at the implications for Canada. Good to have you with us.
Thank you very much, Kirk. A pleasure.
Let's talk, first of all, Michael, about how we actually compare as a country with other countries, and how we share and how we implement digital technology in our health system.
Well, let's add a little bit of a context here, because what we're talking about here is really the implications of COVID-19 or coronavirus, not only in our own healthcare system in Canada, but worldwide, since this is a pandemic. I would say that, for the last 150 years or so, we have looked at this massive centralization of healthcare. That's when we started building general hospitals, and we started bringing people to the solutions, patients to hospitals, general hospitals in general. So that's what happened for the last 150 years. And the public health overall in a lot of developing countries have created tremendous opportunities to, keep us healthy, extend the life expectancy. We went from something like 42 years to about 82, 84, 86 years, so almost doubled in 150 years. So all that together, and with the fact that about 100 years ago was the last time when we had the Spanish flu that affected, a massive amount of people at the time, about a third of the population on the planet, 500 million, and a lot of them unfortunately died, about 40 to 50 million. So that's kind of the context of what happened in all these years. Now, the difference that we see today is that although nobody seemed prepared to deal with this pandemic, I think we are in a much, much better shape overall to deal with this pandemic, despite the fact that we run, short out of ventilators or protection equipment and so on and so forth. I think one of the things that I see worldwide is a new age, if you like, of experimentation and innovation. The healthcare system overall in the world and in Canada as well, I have seen changes happening in the last 2-3 months all over the world, as well as in Canada, that have never seen in 10 or 20 years, which is very good news, I think, for all of us. And I hope that this whole pandemic will set the stage for some massive changes in the status quo, so that we can actually see better outcomes down the road.
Well, okay, we can talk about the future, I guess, in a moment, but let's capture a bit of the present here, and tell me a little bit about what we have seen in this pandemic in the way of implementation of some of the newer technologies. How have they shaped our understanding of COVID-19 and our treatment of it? What sorts of new things are out there?
Well, thank you. Okay, so the number one thing that we have learned is that prevention would have helped us tremendously to deal with this crisis. Also, we have learned that if we had better technologies to look at data and understand what's happening in real time, we would have had probably a better response. What I see out there is companies who suddenly started building very sophisticated ventilators. Companies like Medtronic, for example, who opened up their designs for a lighter version of a ventilator so that others can actually step in, the industry can step in, almost like an open source type of project. And suddenly what you see in that regard, you see the production of those ventilators quadrupled in a very short amount of time. And I think there's this misunderstanding of what ventilators are. They go anywhere from $5,000 ventilators up to $150,000 ventilators, very expensive, very sophisticated machines, which are very hard to duplicate very fast. Mm-hmm. So I'd say ventilators is one thing. We've seen tremendous applications in 3D printing, for example, where a lot of companies, in Canada included, we have seen stepping up in creating those protective equipment very fast using 3D technologies. We have seen a company in Ottawa, Spartan, who have just signed up a deal with the federal government for about 1 million, testing at home kits, which is impressive. That's all how fast we can deliver those kind of things in digital health. So those are just some of the examples that we see there. Here locally in BC, in Victoria, a company like Starfish Medical has signed up a deal as well to create ventilators very fast. So other types of solutions that have to do with not only diagnosis but treatment at home. What we see today is a lot of the folks who suffer through this crisis are people who had previously chronic diseases, whether it's diabetes, COPD, or other types of cardiac diseases, or even mental health for that matter. And so how do we actually treat people at home? And we have seen technologies like telemedicine, telepsychiatry, virtual visits exploding in terms of usage. Yeah. So I think all this, Kirk, it just tells me and tells all of us, I suppose, that the age of sending solutions to the people at home, it's something that the time has come. It's unfortunate that it had to come through this pandemic. But the good news, I would say, is that the whole industry, the public healthcare system, even private healthcare systems will change forever because of COVID-19.
Yeah, I was going to ask, much as there is great tragedy and hardship involving COVID-19, has it actually, you think, created a turning point in the acceptance of things like telemedicine, of things like wider sharing of health information among the public? And in a way, it has allayed the apprehensions that might have been there in the absence of a crisis like this.
Well, I think the answer goes to both sides of this relationship between patients and physicians. I have seen quite a few frustrated family doctors out there in British Columbia, in Alberta, and Ontario, and Quebec, who are very frustrated because they couldn't get in touch with their own patients. Yeah, nobody had set up those kind of telehealth platforms that are safe and secure to be able to kind of restart their companies working from home. So there's a lot of frustration in the medical world, and I hope that frustration comes across in the right way to the ministries and healthcare authorities so that they can actually change that forever. On the other hand, of course, patients at home, let's say you have a parent who suffers of a chronic disease of some kind, and they need care every day, remote care, and that's not set up properly. So I think there's no question that the need was there even before the pandemic. I hope that because of everything that's going on right now, the ministries of health and healthcare authorities will pay attention and transform healthcare kind of forever. Now, what we see so far, Kirk, is that measures like public health, like social distancing, right? The way, the Prime Minister, Dr. Bonnie Henry here in the province are suggesting, those are, measures that you and I can take without any implication from the healthcare system whatsoever. Yeah. The question becomes, okay, once we pass this stage, what else are we going to be dealing with? When are we going to see some spikes? How fast do we react to those? Are we prepared for the next wave, like wave 2, wave 3, wave 4 even, And what I have seen, again, in the industry happening is a lot of companies are looking at innovation in real-time data, like how do we actually understand what's going on in real time. And also I see quite a few companies in what's called the digital therapeutics area, where we're talking about software as a medical device or software as a therapy. So how do we help people at home dealing with their anxiety, their depression, their other types of mental health problems?
Yeah, one of the areas, obviously, Michael, that concerns people as we approach perhaps a slight reopening of the economy, so to speak, is that we still don't really have a clear pile of data about who is infected, who and even who has carried COVID-19. We don't have a widespread testing. Is there anything that is going to arrive imminently around digital health technology that might enable us to have a greater, deeper picture of the testing that's necessary here?
Good question, Kirk. I have seen, the Israelis, for example, have created an application that it works very much like Waze. It's like an Uber, where you actually see what's going on in real time using, COVID virus as an example. We have seen just in the last, I believe, 3 days, Google and Apple trying to close a partnership like never before, so that they can actually look at the data around COVID, around who's infected and who's not. Now, those are technologies and apps that can be developed relatively fast. You need to obviously have the scale that Google and Apple can bring to the table to actually understand what's going on. It's very hard for a startup to actually create that kind of scale. But those technologies, Kirk, do exist. The question becomes, if you as a private citizen, how willing are you to participate in that? And, what is the question or the promise of Google and Apple not to share that kind of information with the wrong hands?
Because hasn't that always been the central tension, Michael, around some of the digital health technology, which is that we trade a degree of our privacy, a degree of our personal information in exchange for really probably some better, more sophisticated treatment, and in a lot of ways, it's become, I think, the central question about the future of some of this technology.
No question that privacy is one of the massive questions on a global scale around this. Digital health has faced that for the last 7-10 years that we've been in business, so to say, as an industry. And so I think we will see a new standard. And in the end, I think if you as a private citizen, if you are informed about the value of you sharing that kind of information, and if you have the right, framework in place, I think privacy can be handled very well. We have done that in other industries like financial services, for example. Yeah. So I think it's a little bit of a myth, and we see like what would have been, the value of us knowing all this information 3 or 6 months ago when it started in Wuhan, China. You see right now the damage to the global economy is going to be probably in the $2 to $3 trillion. So there's no question that sharing that information the right way has tremendous value to you as an individual, to the governments, to employers, to everybody. And so how do we actually handle that properly? Well, that's a question that we should have we should do something about it right away, as opposed to waiting another 5 years of debates.
Yeah, I would imagine too that what must be emerging in the sector that you are part of is a kind of a new momentum and impetus in order to encourage investment by government and by the private sector out the other side of the worst of the COVID-19 crisis, so that to avert, I guess, the possibility of yet another setback of the scale that we've had now. Do you have a sense yet, Michael, about what kind of investment we're talking about here, even as a province or a country, in what it might take?
Very good question, Kirk. And I think we have seen the digital health sector. We have seen the largest investment in the United States. I'll start there, and then I'll go to Canada and BC. The largest investment in the last 10 years happened in the United States in digital health. Something in excess of $14 billion. And so that was the kind of investment we've seen last year there. In Canada, as you know, it's a different story because our public healthcare system doesn't quite allow for investments like that to happen. However, the National Research Council through IRAP, the superclusters, the other types of programs like NSERC programs, they're all investing, in kind of an indirect or direct way in digital health in Canada. When we're looking at an industry, the public healthcare industry in Canada, it's a $260 billion budget nationally. We're looking at about $21 billion budget here in BC. Quebec has already spent more than half of their budget in healthcare. We're very close in BC to spending about 50 cents on a dollar on healthcare. The question then becomes well, in the past, we have spent about 85 to 90% of that budget in acute care, in chronic diseases, And so I hope that in the future we will be smart enough to say, well, we can do better than that. We should start thinking very seriously about public health and also about prevention. And so why do all these chronic diseases happen? How is our environment? How is our education? How does housing play a role in all this? And so I hope that the budgets will start looking at this digital transformation. It's called the digitization of medicine. I hope to see 2%, 3%, 7% of the budget allocated directly to digital health technologies that can help us deal with the next epidemic. There's no question that after this pandemic, we will probably see more crises, public health crises through viruses coming up in the next, 5 years, 10 years. It's almost like what's happening in the climate change. Initially, 10 years ago, we've seen a few storms, and then we've seen more storms, and then wildfires. So we have seen that happening. I think in health, we will probably see something very similar.
Well, last point then. As you know, and you would probably feel this directly yourself, when times are normal, we don't tend to have a very serious debate about things like our investment in a sector like healthcare. We're kind of in a maintenance mode about it, and with nominal increases in funds that perhaps reflect demography and those kinds of things. But what was clear with all of this is that we didn't really adequately prepare for a pandemic. I mean, who sets aside those kinds of resources for some kind of bizarre catastrophe that is off the scale? But I wonder whether you see emerging out of this a different kind of public resolve that might worry a little less about the money that needs to be applied to the task and more about the task itself.
Well, I think, what we have seen in Canada and in BC as well, as you know, we have these healthcare systems, and usually the decisions in terms of investment in healthcare are pretty much top down. It's the government who decides where the money needs to go. What I like to see in the future, and I hope that COVID will help facilitate that, is to actually have that very vigorous, honest conversation about public health that affects us all, and invite the right people at the table, as in the innovators who actually understand what needs to happen in the future. Invite, for example, organizations like credit unions who care very much about healthy communities. Invite industries of the future to the table, because as we have seen, COVID has affected our lives. It has affected education. It has affected the way we work. It has affected the environment. Like everything that was affected by this COVID, I hope that in the future we'll see a better conversation around how much money we need to invest, and also look at, the social impact of what we're actually doing here. That is, I think, critical for us to have a society that is that cares about the people, and that also helps us create, the right economic environment, the right economy to start rebuilding the significant. I'm an optimist here. I think we will see tremendous things happening after this crisis. But also, there's a lot of people who need to rethink their lives, going forward.
Well, we could carry on our conversation for a very long time today, but we're going to stop it off there. But I hope that you'll come back and keep track of this crisis with us and share some insights as you have today. Michael Bidu, thanks so much for your time.
Thanks very much, Kirk. Sure.
Michael Bidu runs Interface Health. It's a digital health technology accelerator. You've been watching Coping with COVID-19. I'm Kirk LaPointe. Thanks a lot for watching. We'll see you next time. Great, man. Thank you.
All right. Thank you very much, Kirk. I hope I managed to answer some of your questions. I didn't want to get